We have the tools to prevent the spread of the virus, and it's important that there is heightened awareness. We are in a third wave in the region. We need to use the tools that we have to prevent the further spread of the virus. It boils down to the leadership of the different countries. We have several countries where we have the resurgence actually going on. So preparedness is key. It includes heightened surveillance, preparedness for critical care, because with the Delta variant, we have high transmissibility. We've also seen evidence that there is prolonged and more severe disease. So working with the countries to build their capacities for treatment, it boils down to information management, the management of risks at the individual level, using the public health and social measures. It also boils down to capacities to manage severe cases.
Africa has had its challenges with regard to access to vaccine. The continent is still below 2% when it comes to vaccination rate. So that's one of the challenges. The other challenge is the fact that there is a high rate of vaccine hesitancy among the population. So how do we reconcile both?
To date, 15 million Africans have been fully vaccinated, which represents just 1.2% of the African population. We have seen that over 70% of the doses that have been given to the continent have actually been administered. If we are really going to achieve the targets that WHO has called on member states to achieve, which is 10% of their population vaccinated by end of September, and an additional 30% of their population vaccinated by end of 2021, we are going to need 1 billion doses in Africa. When it comes to vaccine acceptance, many of them fear the side effects. Many would like to wait and see how this evolves with people they know receiving the vaccine. These are issues that need to be addressed at the local level, and devising tailored, targeted strategies to address these concerns. Once available, ensuring that the supply of vaccine is there, ensuring that there are mechanisms to reach the populations that need the vaccines.
The European Union recently announced that the AstraZeneca vaccine made in India, which is called Covishield, will not be accepted as part of the vaccine passport in Europe. What is your reaction, and how is the WHO addressing this?
AstraZeneca is among the vaccines that have gone through the WHO review and accepted for use. Based on that, the COVAX facility did go ahead to procure these vaccines, and most of the countries in the African region have benefited from this facility. We need to work at the global level to ensure that there is acceptance of this tool that is in place, that people can be allowed the opportunity to use the vaccine and not have the fear of not being able to travel to a given region or another because of lack of a vaccine.
What does this mean, though, for the people who have already received AstraZeneca made in India if they want to go to Europe?
I think that there's going to have to be some strong engagement from the countries that have benefited from this vaccine to ensure that this decision is looked at critically, and the implications it has for people that have received it around the world.
What is being done on the continent to ensure that African science on the continent is also part of this big picture?
We're pleased to note that the president of South Africa and the WHO Director General recently launched an initiative to set up technology transfer hub, the first globally, that will be based in South Africa, that will allow the vaccine stakeholders, global stakeholders, the local stakeholders to come together and provide capacity building and technology transfer to start the production of COVID-19 vaccines on the continent. At the recent World Health Assembly in May, over 100 countries did sign an initiative for local production. 54 of these countries were from the African continent, led by Ethiopia. We are quite optimistic that these initiatives will help to galvanize the support locally using both public and private partnerships and government initiatives to scale up production in the African region.